Hello everyone, welcome to Logic Medico. Today's interesting topic is serratus anterior. So the serratus anterior can be explained under the following heading. What is the meaning of serratus anterior? Location, origin, insertion, nerve supply, action and clinical importance. Let's see one by one. The meaning of serratus anterior is it appears like a sawtooth-like projection. So, therefore called as serratus anterior. Location, it is present on the outer surface of the rib in the axilla. So, it's located on the outer surface of the ribs near the axilla or the armpit area. Origin, from where does this muscle start? So, I'll show you diagrammatically so that it helps you in the exam. So, if you draw like this, if you draw like this 8 ribs, so let's consider you have drawn 8 ribs, 1, 2, 3, 4, 5, 6, 7, 8. So this serratus anterior takes origin from the outer surface of the 8 ribs in the mid-axillary line and the fascia covering the interosseous muscles. So it will appear like a digits or a finger-like projection. So there are 8 digitations. So I'll show you this. This is the first digitation. So like this, second, third, 4, 5, 6, 7 and 8. Now you only see this. Doesn't this appear like a sawtooth-like projections, therefore called as serratus anterior. So these are the 8 digitations of serratus anterior. All these muscles will converge onto the medial border of the scapula, that is the costal surface, medial border of the scapula onto the costal surface. It is the simplest insertion I can tell you. But if you want more specific answer, just draw the scapula and complete the diagram. Here is the scapula, medial border. So this is the internodal cavity. So you can see it's attached to the medial border. Here we can see the acromion and the thoracic process projecting forward like this. Okay. So it's inserted to the medial border of the scapula, costal surface of the medial border of the scapula, or the anterior surface. To be more specific, the first digitation is attached from the superior angle, this area, till the level of the root of the spine of scapula. I'll show it in a different color so that you understand. Here the root of the spine of scapula will be there like this on the posterior aspect. Till that level only the first digitation will be there. Okay, from the superior angle to the root. The second and third digitation will extend the entire medial border except the inferior angle. So this is for the first and this is for second and third. Okay, the remaining lower from 4th to 8th digitation, these muscle fibers are getting attached to the triangular area, this triangular area on the inferior angle of the scapula. I'll show you this area. I'll show you in divided fashion so that you can understand better. Yeah, like this. So now you can see from 4th to 8th digitation, the muscle is attached to the small triangular area on the inferior angle of the scapula. The first digitation to the superior angle of scapula, the second to third digitation, the remaining part of the medial border of scapula. 4th to 8th digitations are attached to the inferior angle of the scapula. This is the more specific insertion of the serratus anterior. If asked for 5 marks, you can explain like that. If asked for 3 marks, all that you have to say is it takes origin from the outer surface of the upper 8 ribs by 8 digitations inserted on the medial border of scapula, the coastal surface of the medial border of scapula. So scapula is the insertion, origin is the ribs. Nerve supply for this is interesting. There is one nerve beginning from the roots of the brachial plexus C5, C6 and C7. These three roots it's beginning, and after beginning from these three roots, this nerve is descending down alongside the thorax. Descending along the side of the thorax in the mid-axillary line, it supplies serratus anterior. Therefore, the name of the nerve is nerve to serratus anterior. Nerve to serratus anterior. Since it is descending along the thorax, we can also call it as long thoracic nerve. This is the fancy name for this, long thoracic nerve. Why is it called like that? Because it is descending along the thorax, vertically along the thorax. So it's called as long thoracic nerve. Root value C5C6C7. To be more specific, the C5 supplies the fibers from C5, supplies the first and second digitation. The third and fourth digitation is supplied by C6, and the remaining 4 digitation is supplied by C7. The more specific innervation, but if we just tell the long thoracic nerve supplies the serratus anterior, it's good enough. Coming to the last aspect, that is action. Moving on to the action. This serratus anterior, along with pectoralis minor, it pushes the scapula forward. So when the scapula moves forward across the thoracic cage, across the rib cage, if it moves like this across the rib cage, the movement is called as protraction. So this is the main action. There are other actions. These fibers which are inserted to the inferior angle, the 4th to 5th digitations, 4th to 8th digitations, they pull the scapula forwards and they rotate the scapula in such a way, when the scapula which is oriented like this, if it gets rotated, so along with the trapezius, what is going to happen? The glenoidal cavity will turn upwards like this. So because this will push it towards the atrium, trapezius will pull it upwards. So this will pull forwards. Okay, serratus anterior will pull forwards, trapezius tries to pull upwards. So if neither goes upwards nor goes forwards, the scapula will rotate on its axis so that the glenoidal cavity faces upwards. This action helps in overhead abduction of the shoulder joint. Overhead abduction. This is another prime action of serratus anterior. This is the reason why they give this question as a 5 marker, because there are so many things to be written. Also, whenever a person is carrying some weight, for example, the person is carrying something in his hand, he is carrying some bucket of water. Let's consider a bucket of water. Imagine the person is carrying the bucket of water in his hand, he is holding that in the hand, but the weight is transmitted to the upper limb, so the scapula has to be steadied. So it steadies the scapula. That is also by holding on to the thoracic cage, it steadies the scapula. Acting from the scapular side, you can pull the rib like this, similar to the pectoralis major and minor. So when it pulls the rib outwards, obviously there is a negative intrathoracic pressure causing inspiration. So this is the other action. It's an accessory muscle of inspiration. Some smokers will use this in resting position only to breathe. Okay. So the actions include, number 1, protraction of scapula, which is a forward movement of the scapula. Number 2, rotation of the scapula, thereby helping in overhead abduction of the shoulder joint, overhead abduction of the arm, okay, at the shoulder joint. While carrying the weight in the upper limb, it steadies the scapula, it keeps the scapula in place. Also, by acting from the scapular side, it pulls the rib outwards, causing a negative intrathoracic pressure and a forceful inspiration. That is the other action. So these are the 4 actions of serratus anterior. Moving on to the clinical importance, Damage to this long thoracic nerve causes winging of scapula. If you see the any person's back, normally the scapula is not visible clearly, okay, because the medial border of the scapula is kept in place by serratus anterior. In a person who has got damage to the long thoracic nerve, the medial border of scapula is unduly prominent. The other scapula is not visible, but this scapula, the medial border is more prominent. So it appears like a person has got a wing, okay, therefore it's called a fancy name, winging of scapula. Winging of scapula. This is a clinical application of this. So for testing of the scapula, what we can do is, we can ask the person to push onto the wall. When he pushes onto the wall, usually the medial border should not become prominent. If it becomes prominent, that means he has got paralysis of serratus anterior. We can ask the patient to push onto a wall or a door. Normally, the serratus anterior will not become prominent, or the medial border will not become prominent. If it becomes prominent, that means it is paralyzed. To summarize in a simplest possible way, the serratus anterior, it's called so because it is present on the anterior plane, axilla. It appears like a sawtooth, therefore it's called like that. Location, I told you already, it's there in the axilla, on the outer surface of the ribs, like a sawtooth. Origin from the outer surface of the upper 8 ribs. Insertion to the medial border of the scapula costal surface by 8 digitations. Nerve supply from C5C6C7, the roots of brachial plexus, as a long nerve descending on the thorax, therefore called as long thoracic nerve, also called nerve to serratus anterior. If you can't remember, you can write nerve to serratus, no problem. If you remember, you can write the fancy name long thoracic nerve. Action: pulls the scapula forward, it's called protraction. It rotates the scapula in such a way glenoidal cavity faces upwards, and that is called as overhead abduction of the shoulder, that is causing that. And the third action is, when carrying the weight in the upper limb, any weight you are carrying in the upper limb, it steadies the scapula. Also, acting from the scapular side, it pulls the rib outwards, thereby causing negative intrathoracic pressure, helping in inspiration. This is the other action. Clinical application: damage to the long thoracic nerve makes the medial border of the scapula unduly prominent, and that is called as, that is appearing like a person has got a wing but actually can't fly. But the condition is called winging of scapula. Most frequently asked 3 marks question: what is winging of scapula? If I am the student, I'll answer: winging of scapula is a condition in which the medial border of the scapula is unduly prominent. Why? Next I'll answer: because of the paralysis of serratus anterior. How does the serratus anterior gets paralyzed? Because of the damage to the long thoracic nerve in the mid-axillary line, either during surgery in the axilla or intercostal tube drainage in the chest in the mid-axillary line. Therefore, we should avoid these points, okay, and we should be careful to preserve these nerves. Okay, that is, this causes medial border of scapula to be unduly prominent, and the condition is called winging of scapula. So this is what I will write. Thank you for watching and learning from Logic Medico. Don't forget to subscribe to our channel and pressing the thumbs up icon. It helps the video share others to reach others also. So please like this video and share this video with our other friends. Thank you. Bye.